And welcome back. Well, nobody wants to live in pain, but finding relief shouldn't come at a greater cost. That's why the CDC is turning to safer alternatives to opioids like physical therapy. Joining us now is Sarah Wenger from the American Physical Therapy Association with more information on this type of pain management. Good morning to you, Sarah.
Good morning, Tiffany.
Thanks for joining us. I think a lot of us have heard about the dangers of opioid use in terms of managing pain, and we think about, the addictions and whatnot. Talk a little bit about the long-term, problem when it comes to opioids for pain management.
So taking opioids long-term can definitely lead to addiction and to overdose. Can also lead to tolerance, which is when over time your body gets used to the medicine and then you need higher and higher doses of the medicine to get the same amount of pain relief. And so that can definitely lead to overdose and lead to addiction problems if you're taking more and more of it. It can also cause nausea, vomiting, and dry mouth, which are not serious symptoms, but can be very unpleasant. Another unpleasant symptom is constipation, which is particularly difficult for people who have back pain, because if you're bearing down on the toilet, this does not usually make your back happy. And then you can get depression, which we know is associated with pain. So depression can increase pain and can make pain last longer. So something that causes depression is definitely counterproductive. And then lastly, it can cause opioid-induced hyperalgesia, which is when you actually experience more pain as a result of taking opioids.
I think all those things are scary to think about. I had to take some after a shoulder surgery just for a short period of time. And even after that, I felt like it was difficult when you're weaning off of them. So let's talk about some alternatives when it comes to pain management. What are you seeing?
So what we really recommend is in recognizing that pain is a complicated problem with multiple different contributing factors, we really recommend an interprofessional approach. So an approach where you're getting medical care, where you're getting some kind of care for your mental health, because pain can just, it causes anxiety and depression and strains your relationships at work and at home, and it can just be so tough to live with pain. So getting some mental health support, getting some help moving, and that's where physical therapists come in, and then making sure that all of those different areas are providing education so that patients really learn how to manage pain on their own, and they have things they can do that are not medications with bad side effects and do not necessitate them coming in for an appointment, or they really have things they can do on their own at home that really work for them to manage pain. So in terms of physical therapy specifically, what we do is we really look at someone's capacity and compare that to the demands that are on them. So if somebody has a sit-down job versus, they're lifting all day long or running a jackhammer or something like that, or they're playing a sport, or they're a new mom with an infant, or they're a new dad with an infant, or they, need to walk the dog, or whatever it is that the demands, whatever physical demands are on each person every day, that we're looking at their capacity to meet those demands. So are they strong enough? Are they fit enough? Do they have good enough alignment or good enough balance? And we work with them to improve their capacity, but we also work to change the tasks so that they're easier to do. So like changing how a task is dosed, changing the position someone's in when they're doing the task, or changing like where somebody's putting in a rest versus doing it, and changing how people complete tasks so that they're better at doing them and they're getting less flare-up pain afterwards.
One of the things I loved about physical therapy is they were comfortable expressing what your limitations were as well. So a lot of times I think we push ourselves to a point where we can re-injure ourselves, and they would also give you that permission to push harder or pull back. And I thought that was as important. How are you guys spreading awareness about PT being a positive and safer alternative?
So I think you make a really good point about the education piece, and we do always make an effort to make sure that patients understand what's safe for them to do and what isn't safe so that they can make good choices about whether to push or whether to rest. In terms of getting that information out to the public, we have the choosept.com website, and that has a lot of information for consumers. It has a place where you can find a local PT in your area, and it's got a bunch of information about what PT does and the risks of taking opioids. So it's a really good site for resources.
Thank you, Sarah, so much. That website again is choosept.com.